listening to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Partner Show. And we are also on a podcast on Spreaker, so look us up on that. Jeannie Roller is my co-host. We're talking about healthcare issues. We started this podcast and this show, Jeannie, a couple of years ago because we found the care that we received in the healthcare industry not to be the best, and actually it was quite traumatic for us, for your husband, for people in my family, and we wanted to get answers for ourselves and try to get answers for other people to help then. And now it's been, 5-6 years or so since it's happened to us. And we have gotten some answers. And one thing I brought to your attention this week is I was happy to see that media is starting to cover more of these stories when we had been told all along that, no, this didn't happen. We don't treat patients like this, basically that we were making it all up, and we knew that we weren't. So I want to also mention, because we try to do this too, I stick up for the medical people that are in the arena that have to navigate some of these big boxes, what I labeled them, healthcare systems, healthcare facilities. And I went to a new cardiologist locally here in South Florida last week because, I have to go for my own medical care too. And believe me, it was a shock when I had to regroup and think, well, now what do I do when I was blindly trusting like you did, Jeannie, and your husband did as well. And I was absolutely fascinated and overjoyed that the cardiologist that I found, what a good experience I had and how professional they were. Very, very busy office. My appointment was at 4 o'clock on a Friday. A lot of these doctors don't even work on Fridays. Totally HIPAA compliant. The only thing you wrote down to check in, because we've talked about this too, Jeannie, where people hear everything through that sliding glass door, if you will. They're spouting out your name, your social security number, whatever you're there for, the whole bit. The only thing they talked about was your last name. That was it. The minute you wrote your name on that sticker, they peeled it off and they put it on whatever your chart they were using for that day. I was completely impressed. And the least amount of educated person that this cardiologist had in his office was a nurse practitioner. So fairly educated. It wasn't a medical, you weren't talking with a medical assistant that we've talked about so many times. So kudos to that cardiologist. And it was he was in a heart clinic, if you will. And it was a clinic that had a lot of patients that were Medicare aged, a lot of patients that were their salaries weren't very high. It wasn't like this, highly specialized or whatever. So I'm, kudos to them, and I'll post the name and all of that as well, because that's the type of doctor that I want to go to and that type of care that I want to have. And we talk about that all the time, Jeannie. So let's talk about the article that I sent to you that now is stating that these hospital systems have to rethink what their game plan is, because we as patients have options. And I'm glad that a lot of this is coming out. You know what? Because we do have options. You and I talk about that. And that's one of the things I say to everyone out there, the listeners. If it doesn't feel right, leave. Get another appointment. You don't have to put up with that kind of care. Some of the maybe highly specialized ones, I can't talk for everything, but there are other doctors out there, and I've done it, and you've done it, Jeannie. I just go to another office. I'm not putting up with it anymore. I really am not doing it. So go ahead.
Yeah, well, the article talked about how because many services are shifting towards outpatient rather than hospital services, hospitals, these big box hospitals, are losing money. Things like oncology and orthopedic care. And I think that the stents, heart stenting or angioplasty is on its way towards being an outpatient procedure rather than an inpatient. So there's something else I'll take a hit on. Mm-hmm. And it when they lose those high money making services, then they begin to look for other ways to make money, such mm-hmm. as charging insurance customers more money, mm-hmm. which is one way that they do it. But the thing is, and what it comes down to is that hospitals need to reduce their expenses without compromising their services even more, because when you go to hospitals, the floor nurses, they have way too many patients to care for.
Absolutely.
And some of them use or LPNs, I'm sorry,
Yeah.
rather than RNs for patient care. And that's kind of iffy in my opinion, because I would rather have a nurse that I know is qualified by education rather than one who's just qualified because she's warm bodied and she's there, or he, whatever the case. But the thing is, they have so much in administrative cost. They have large staff of attorneys.
You're right.
They have a lot of expenses.
Risk management, advocates, all that work for them to, talk their talk and walk their walk. Yeah.
Yeah. They have their so-called patient advocates who, in my opinion, aren't really there for the patients, but are there to protect the hospitals.
Right. Well, that's what I mean. Yeah.
Yeah. Yeah. They need to take a look at some of this stuff and make some adjustments. It also is that because these hospital systems are getting so big that the smaller hospitals, they cannot compete really. It's like grocery stores. Once you started getting all the big grocery stores, the smaller mom and pop stores went out of business because they could no longer afford to compete with the big box stores.
Yeah, the chains and stuff. Yeah.
Yeah.
So I say kudos to what I was saying about that cardiologist. A lot of the systems that I've seen locally are, and an orthopedic facility is a group of doctors, 10, 12, 15 of them. That's what my ortho center is here. They call it like the third hospital in this county or whatever, because they want the control over it, and and any time I've gone to that one is good care. There's 15, maybe 20 doctors there. The place is packed. The care is unbelievable, and they have the quality control over it. And they're not in those big box systems. So, I mean, kudos to them. That's what I'm looking for. That's patient care.
Yeah. And the thing is, Cindy, that there's research that shows when hospitals consolidate, costs go up. And that is really weird that the costs go up when they become larger. So, patient cost goes up. I argue that patient quality of care goes down.
Absolutely.
When they grow.
Yeah.
Most people like me would prefer outpatient care. I would prefer, to be in and out, go in one day and out the next kind of thing. That's what a lot of outpatient places can do.
Right. Well, that's totally true. And the other thing is, you're not there in, how many times have we heard people that get like sepsis, that get these other kind of, airborne diseases or whatever, when you're in a big facility like that with so many people going in and out. I mean, certainly it has its purposes, but I'm with you. I'm totally with you. I'm sold on a lot of it. I'm not saying everyone is, the top of the line from what we've interviewed people, but I mean, the heart center that I went to, that's what it's called, the heart center, and they probably had 8 cardiologists there, and every one of them had nurse practitioners. There was not anyone even that was an RN. I was just blown away with how good the care was. And like I said, the average salary of the people that I saw, as including myself, as I saw as patients, were not millionaires, or, I mean, they were just your average working person, and they were getting really good care, and they got my applause. Totally. That's what I want to see. So I want to see these stories coming out there, because you and I have been working on this for a long time, and we want to get the message out there that we're not fodder for, you to make your profit. That's not what we're here for. We're human beings, and we deserve to have the respect and the care that we pay dearly for, because our rates are expensive. It's not like we're getting this stuff cheap. And the U.S. healthcare system, I know the money that has been sunk into it is a lot of money. It's in the billions. And so we deserve to have good care. It shouldn't be the bottom line is what the profit is for some big facility, because, 10 people are making money off of our life of, medical needs. On that note, stay tuned to Evergreen Media Network.